Hello, my name is Dr. Michael Kodsey, and I am an orthopedic surgeon at the Everett Clinic here in Everett, Washington. And I'd like to talk about one of the most common questions I get from my patients, which is, why is my shoulder painful? And I think the best place to start with that answer is with the anatomy of the shoulder joint. Here is a picture of the bone of your arm, and on the top of that bone is the ball of your shoulder, and that articulates with this small little cup right here, and that attaches to your shoulder blade here. This bone right here is something you can often feel if you put your hand behind your back, and this is the spine of the scapula, and that curves around to the front, and then that articulates. There's a joint right here, and that articulates with your collarbone right here. Now this joint here and this joint here can both get worn out, and that is what we call arthritis. So one of the more common causes of pain in any one of your joints is arthritis, when those joints wear out. Now, if we look at the muscles that cover that shoulder blade and that joint, you can see these are your rotator cuff muscles up here on the top, up on the back, and then here in the front. They attach to these tendons here, and these are your rotator cuff tendons. Here's one on the front, and this is the back of your shoulder. These tendons can become inflamed, and what we often call a tendinitis. So tendinitis can be a common cause of shoulder pain, and when the tendons become inflamed, this bursa, which is up on the top here, can also become inflamed, this whole area here, and this bursa here can get filled with fluid and become full and give you that kind of full feeling and give you pain around the entire shoulder, in the front and in the side. And what's often a little alarming is pain that comes all the way down the side of the arm here. And some people even have pain that's just right here. And you go, why does it hurt me right here in my arm? What's going on in that bone there? Well, it's because any pain that is coming here can radiate to this muscle, and then that goes right on down to this spot right here. So it is pretty common for people to come in and say they have pain here when it is the shoulder that's actually causing most of the pain. Now, the tendon here and this bursa can also be irritated by bone spurs. Bone spurs form on the bottom of this shoulder blade here, the bottom of this bone right here, and it's a normal aging process, and this can also be worsened by any kind of injury, and that bone spur can dig into this bursa and cause inflammation here and pain, and it can dig on down through the bursa and to the tendon, and that is what we often call impingement syndrome. Impingement syndrome is probably the most common cause of shoulder pain that I see in my office. Now, if the impingement syndrome becomes very bad and that rotator cuff tendon gets irritated enough, sometimes you can get small tears in that tendon. Or if someone falls and they have a really big injury, you could have a full tear of this tendon right here, where it just completely separates in the middle of the tendon. And rotator cuff tears can definitely be a source of pain. So rotator cuff tears. Now, another tendon which can cause pain in your arm is this biceps tendon here. This biceps connects to the muscle down below in your arm, and this tendon has to move nice and smoothly up inside your shoulder joint here. And if this tendon becomes torn, or it becomes enlarged because it takes on fluid as it degenerates, it won't move nice and smoothly through here anymore, and it can cause pain. And that pain is typically in the front of your shoulder, and again radiates down your biceps right here. And so we have the biceps tendon as another source of pain. Now, a fifth source of pain here is tissue that's deep inside the joint here, and it helps keep this ball of the shoulder joint located in this small shallow cup. And it is a tissue that goes around This cup here, it is called your labrum, and sometimes with overuse or with a traumatic injury, you can injure that labrum and it can cause pain. Typically, an injury to the labrum can make your shoulder joint unstable, but occasionally a tear can also cause pain. And lastly, a very common problem that you can't really see if you just look at it with a camera, or if you kind of look inside the shoulder, but you can see it just by looking at how a person's joint moves, and that is when all this tissue around the shoulder becomes very stiff and it does not stretch like it normally should. And patients start to lose motion and get a lot of pain in the shoulder. And that is called a frozen shoulder. And patients complain not just of pain, but they feel like the shoulder is completely frozen. It just doesn't want to move. And that's why we call it frozen shoulder. So these are the most common causes of pain in the shoulder. And again, the pain can be in the front, the side of the shoulder, or all the way down the middle of the arm. And the best way to make a diagnosis of which one of these things is causing your pain is to see a doctor, so that they can talk to you about your pain, talk about the pattern of the pain, and especially examine your shoulder so they can try and find out exactly what's causing the pain and get you the best treatment.